All right, David, so you're having problems with your shoulder?
Yes.
When you're bench pressing?
Yes.
Show me exactly where you get the pain.
So along the side, around the rotator cuff.
Right in here?
Yes.
And how long has that been going on for?
At least 6 months.
6 months. So what happens when you bench?
Deep pain, cracking, a bit of discomfort when I'm lying on the bench, pressing on the bench, or even swinging around my rotator cuff. Yeah.
Did you injure yourself in some way, or did it just come on gradually?
I believe so, yes.
Okay. Now, what else do you have wrong with you?
My knee as well. It's on the side of my knee. Discomfort when I'm squatting or when I'm bending over. Even when...
So the medial aspect of your knee?
Yes.
Right in here?
Yes.
Does it feel like it's under your kneecap or to the inside?
About under my kneecap and a little bit on the side.
Does it click a bit when you're working out?
Not too much.
Okay.
When I'm kicking
When you're,
my leg.
when you're doing extensions?
Yes.
Okay. What about squats? What happens when you squat?
Just feels painful on the side.
Okay. So we'll look through these issues and see if we can find anything that's not working properly. Well, let me show you how we do this. We start with finding a muscle that is strong and in the clear. We call it strong in the clear. And I'm going to ask you to push up against my hand towards the ceiling, okay? And I'm not going to let your arm drift or try and trick you into weakness. You have to lock against my hand, okay? And I can put quite a bit of weight against you because your muscle spindles fire in your middle deltoid.
Yes.
And you seem to be strong. Okay, you can lock the muscle. Let's do the anterior. You can lock the anterior very well. Okay. Now let's see what happens when we do the middle deltoid on this side. And push up. And do you notice what's happening there? You try and lock against my hand, and it just gives out. Right. Okay. What happens with the anterior? Push up. Now I can see that you're really struggling to do that. All right, in a muscle test, it's very important that we don't try to overpower you and to see how much stronger we are than you. It's really not a feat of strength. It's a test of the muscle spindle reaction. And it's very important that you don't bite your teeth together, all right? Don't grate your teeth together. So keep your mouth gapped just a bit, okay? Just a bit. Don't let them touch, all right? Now, that's a more pure test. Okay, now keep your mouth just gapped, your teeth gapped, and resist, and you'll notice that you're even weaker. Okay, keep your mouth open. Okay, now I want you to bite down, and now resist. Feel any difference?
Well, yeah.
Yeah, okay, so we don't want you to bite down because for some reason there's a circuit neurologically that overpowers the inability of your muscle spindles to react here. But we want to see what you're like normally. So we don't want you benching by having to bite down on your teeth, because that's a neurological trick to get these muscle spindles to fire. Okay, well, let's do another muscle test. Lay on your back, please. The muscle test that I really like to use is the quadriceps muscle. And we're going to just, I'm going to ask you, so quadriceps is best tested around here. If you're really good at testing, you can go up to 90 degrees. All right? But if you go too far, you end up picking up the iliopsoas muscle, which is a deep muscle coming off your spine. Pull back, please. And we don't really want to test that muscle. We want to test your rectus femoris. And at this angle is perfect. Now pull back, please. And that's great. You notice how you can lock against me? No problems doing that? Okay. Now let's see what happens when you do this one. Okay, resist, and that's pretty good. All right, you can lock, no problem. You're not biting down. Good. I'm going to take some quantum alignment technique devices, and I'm going to place one on your sternum. It's actually right over your conception vessel, anywhere along the central line of your body. And we're going to do the same test and resist, and again, and you're nice and strong. All right, if we take two devices and place them one above each other on the central line, the conception vessel, do the same test, let's see what happens. Want to try that again? Pull back. You just can't engage, can you? Try again. And that's actually normal. All right, so we want you to be weak when those two are lined up like that. All right, I'm going to place one on your forehead now and resist. All right, and that's normal as well. You're supposed to go weak here and here and here and here. This particular test measures your polarity to see if it's normal, and this test measures your neurological organization, and yours is pretty good. All right, so now that we know that, we can do some other tests on you. Right, so the first test I'd like to do with you is what we call eyes into distortion. So we're going to use this previously strong muscle, and I'm going to ask you to follow my finger, make sure you don't bite down, and this eyes to the right laterally. Hold there, please. Keep it there, and I'm watching you to see if your eyes flicker. Pull back, please. And they flicker quite a lot, and you notice that you can't resist. All right, so let's go lateral to the left. Now hold there, don't bite down. Pull back, please. You can do that quite nicely. You want to go back to the right again? Hold there, please, and pull back. And you notice you can't do it. All right. That's usually an indicator that there's some problem in the region of the TMJ or the sphenoid bone or the frontal bone, or you could have, you know, a C1 occiput problem with that too. All right, and it's usually on the same side that when you look in that direction, you go weak. A previously strong muscle goes weak. All right, let's see what happens when you go up to the top right-hand corner. Keep it there, please. Keep it there, and now pull back, please. All right. Now your eyes, you did that, but your eyes really flickered a lot to that side. So I suspect that there's something wrong in this area, but we won't make any decisions yet. Now, bottom right-hand corner, keep it down, eyes to the bottom right-hand corner, pull back, please. That's easy for you, okay? Bottom left-hand corner, hold there, pull back, please. Top left-hand corner, keep it there, and pull back, please. And that's easy. So your weaknesses seem to be lateral to the right and slightly upwards to the right. Keep it there, please. Upwards to the right, pull back, please. Your eyes are flickering and you go weak. Now, maybe that you have cranial faults on this side and a TMJ that goes with it. So you have two problems on that side. Have you ever been hit hard in your head on that side? Have you ever had a concussion?
No.
Nothing like that, okay? Because often concussions or head injuries cause that, all right? Have you ever had a neck problem?
Not really.
Okay.
No.
Okay. Have you ever had a clicky jaw?
No.
No? Okay. Well, let's locate and see if you have any what we call injuries that have been recorded in your nervous system over a long period of time. All right? So we'll start with your jaw. You use a single device. The other two matched devices, by the way, these devices resonate with one another. The physicists make them in such a way that they literally are connected by a frequency. Okay? So I want you to hold that over your TMJ. Okay, hold it there, please. And I want you to gap your mouth a bit. And now pull back, please. That's normal. Let's go over your temporal bone, because we saw eyes into distortion, top right and lateral, so we should test the temporal bone. Pull back, please. That's normal. So no past injuries there. Let's go to your occiput and C1. Mouth gapped and pull back, please. You have a problem there. You notice how weak you went? All right. All right. So I suspect, because I've seen this many, many times in the past, that you had maybe a fall where you landed on the back of your head and banged your head hard. Even when you're a child, the injury becomes recorded in your nervous system. This was discovered in the early 80s that this neurological pathway exists. And when you had a trauma, all right, you get this neurological pathway that stays there. So in your case, it's at your occiput C1. So we're going to hold a device right here, once again, over the occiput and C1. I'm going to retest you to see how weak you are. And you go completely weak. You can't lock it, can you? Then we'll take a second device, and to treat this past injury, to erase it, we send a signal up through the talotibial joint, through your nervous system. And we'll do it from this side. It only takes about 2 or 3 seconds. You'll leave that there. I'll put this one down. And now pull back, please. How do you feel now? It's strong. Okay? Good. Now I'm curious. I wonder if the eyes into distortion, that is when you look to the right laterally and upwards laterally was caused by this previous past injury memory stored in your nervous system. Let's find out, okay? So eyes to the right. Remember, gap your mouth a bit, don't bite down. Keep it there, please. And now pull back. Different?
Yeah, different.
Yeah, keep it there, mouth gapped. Pull back, please. Perfect. Quite a difference. Mm-hmm. Now up to the top right. Keep it there, mouth gapped again. Pull back, please. And that didn't fix, all right? So there might be something else. Well, let's look for a past injury in a different place. First one I always test is the frontal bone, okay? Hold that there for me, or sometimes it just stays, all right? And now mouth gapped, and now pull back. It's not there. We can test parietal bone just by placing it right over the parietal bone, and now pull back. And I think we've already tested the temporal, but let's do it once more. Pull back, please. Oh, maybe we didn't test the temporal, did we? Did you notice the difference? That's quite noticeable. So at some point in time, either when you injured your occiput C1 area, you may have banged the temporal bone and the memory of the trauma stayed in your nervous system. So, same treatment again, just going to touch the talotibial joint with a matching device. And here, again, good. And now we'll retest you. Let's see if you can resist. Pull back. Perfect. Mm-hmm. Now, let's take that away. Once again, we'll test eyes into distortion. Eyes to the right, mouth gapped, hold, pull back please. Perfect. Eyes top right, mouth gapped, pull back please. Much better. All right, you were able to resist, but what I noticed is that you have a little bit of a twitch with your eye to the top right. So I'm going to now test to see if you have what we call a disconnect between the temporal bone, which was injured in the past, or the occipital bone and your motor cortex, because there are little receptors in all our joints and all our muscles that communicate with our brain. And when we disconnect those, probably due to injury, we also have an inability to use the muscles that are associated with those joints. So we're just going to check now, okay? To do that, we place one device here on the center line. Then I'm going to have you hold this one right here on the temporal bone. Good. Once again, same test, mouth gapped. Nothing there. Temporal's good. Let's go C1 occiput. Okay? Okay, ready? And pull back, please. Yeah, there's your disconnect. All right? Now, if I take this away, we're measuring injury, past recorded injury. Pull back, please. No, we already fixed that. This test here is to see whether the proprioceptors in that joint, or that group of joints, is communicating properly with the motor cortex. And it's not, all right? And typically in chiropractic, what we do is we palpate to see if a joint is locked. And I haven't palpated you yet, I will in a second, to see if it's locked, because it's almost always that there's a joint lock in association with this finding. So what these devices do is really accurately determine where the receptors in the joint are dysfunctional, and we can crack you to free it up, or we can use the device to free it up. But let's just quickly see what your joint is feeling like. Okay. Tender there? Mm-hmm. Yeah, a bit tender. So I think those muscles have been struggling with you weight training for quite some time because there hasn't been good function there. All right, so once again, we'll put it right here. There's another device right here, and you're going to probably go weak. And now what we do is we take the one that's on your chest and we run it over top your motor cortex, right over the motor strip, all right? Just like so. I'll put it back, and now pull back, please. How much stronger are you now? Yeah, okay. I'm curious to see whether your eyes into distortion has improved at all, all right? So eyes up to the right. Now what I'm looking for is how much flicker you have. Keep it there, pull back. Good, now mouth gapped, right? No cheating, because that really causes the cheat. Okay, hold there. Now pull back. Okay, much stronger. A little bit of flicker still. So it may take time for your nervous system to correct over a period of time as new movement comes into your body. All right? So let's check this shoulder of yours. Okay. All right, so we know you've got a problem. You've had it for 6 months. I want to know if you've got an injury to that section of your shoulder. So let's go over the acromioclavicular joint first. Okay, take your left hand. I think yeah, you can do it with your right. Okay. Okay, pull back, please. Nothing there. Okay, sternoclavicular joint. Nothing there. Let's just go straight over the humerus, right? Just hold that right there. Take that hand down and pull back, please. Right over the head of the humerus. You've got a problem. Your brain thinks you've got an injury there. Really noticeable because you went weak. So how do we reset a previous injury? Simply go to the talotibial joint, hold a device on it, and what I like to do is just rub around a large joint just to send the signal through the joint. Okay, hold there, and you can do the same thing. You can just rub it around here like so. Okay, good. And now we'll take this away and retest. Pull back, please. Easy. Yeah, good. All right, so I'm curious as to whether or not you have a disconnect with those muscles. All right, because the muscle spindles that weren't firing when we tested you on your anterior deltoid didn't allow you to lock up that muscle very well, remember? So to test a muscle, to see if it's disconnected, we place one device over your eye, all right? And we take another one and put it on the center line of the body. So 3 devices, one over the suspected muscle spindles that are not connected and firing, one over the eyes, and one over the conception vessel. Let's see what happens to you. Pull back, please. It's extremely weak. All right? All right. In that case, we take this over the motor strip. I'll rub this over your anterior deltoid. And I might as well go over your middle deltoid as well, because I think you've been recruiting muscles to get the bench pressing done properly. And you probably have injuries or muscle spindles shut off in that group as well. And I think what we're going to do is just do your talotibial joint as well, in case there's an injury to the muscle through there. All right, good. Now, sit up for me. Let's see if it's made any difference to how your brain reacts when we test your anterior deltoid. Now remember, no cheating with your jaw. Push up towards the ceiling. How much different is that?
Stronger.
How much stronger?
Way stronger than before.
Okay, let's see what the middle deltoid is. Mouth gap, no cheating. Pull back, please. Okay, this one is not as good as the anterior. Pull back, push up. Anterior deltoid, huge difference. All right, so let's just redo the anterior deltoid, or the middle deltoid. All right, so if you bring your ankle up and just hold that right there for me. Okay, good. We're going to rub it all over your middle. Okay, just like this. Middle deltoid. Going to get all the fibers. Okay, let that go now. And we're just going to do let's do it. Hold that right there with your left hand. The first thing I did on you was incorrect. It has to be, in order to treat a muscle for an injury, you have to have it there, all right? And over your anterior deltoid and over your middle deltoid. So we're going to repeat it. Sometimes you have to do injury recall to muscles and joints twice in the same treatment. Don't know why, it just happens that way. Now we're going to reconnect that anterior deltoid a bit better and see how that works. And we're going to do the middle deltoid as well. Let's do them all. Let's do this once more, just in case. Okay, injury recall correction, reconnection. Okay, so now we've done both anterior and middle deltoid. I want to know if you feel more confidence. Push up. That one feels like you can lock it really well. I wonder if this one will lock. Remember, no cheating with your mouth. Pull back, push up, and push up. I feel like you're locking that much better. Do you feel the same?
Yeah, it's better.
Okay, good. So I think it's going to take a while for your brain to process this new information, so that when you're benching, you're using all the muscles appropriately during the bench press. Okay? Excellent. We're going to look at your leg later.
Okay.
But thanks for letting us do this on you, okay?
No problem.
Thank you.